As the U.S. tries to return to normalcy amid COVID, the easing of mask mandates and social gathering restrictions, along with the spread of a more contagious variant, is causing a rise of new infections in parts of the country. It's also affecting the mental well-being of healthcare workers still on the front lines nearly a year and a half into the pandemic. In his latest article, New York Times health and science reporter Andrew Jacobs spoke with doctors and nurses exhausted from new cases who are now dealing with burnout and prolonged stress. So Andrew is here to discuss. Andrew, thank you so much for joining us. You know, when I took a look at your article, I thought we're calling it burnout, but it's almost like afterburn, because I feel like 7-8 months into this pandemic, doctors and nurses were saying we are burning out, and they still worked on. And now I don't know what comes after you're burnt out, but you have to keep working. From the doctors that you spoke to, tell me how they're feeling. Are they afraid of yet another surge because of this Delta variant?
They're afraid of localized surges, and it's not just afraid, they're actually experiencing them. Keep in mind, there are still 70,000 people in the hospital right now across the country with COVID. Hundreds are dying a day. So it's not just a theory at this point, it's happening. It depends on which hospital, of course, but a lot of the doctors and nurses right now are just feeling unappreciated. It's really reached a crisis point. There's so many nurses and doctors have left the field. There are fewer in the hospitals to deal with sick patients. And the fact that there's so many Americans are unvaccinated is just making them feel unappreciated, unvalued, because 16 months in, they're still at it. And they are exhausted. A lot of them are not able to take vacations, and they're just exhausted.
Yeah. We've already sort of reported on the emotional fallout when it comes to healthcare providers. It kind of shows up in different ways. Some have chosen to retire early, but we've certainly reported on suicides as well. How are they dealing with the stress of the burnout? And is there any help out there? We're not just talking about banging pots and pans, every day to say we're supporting you, or holding a ticker tape parade. I mean, real help.
I mean, of course, there are programs that healthcare workers can access at their hospitals, and there are nonprofits that help them. But, the bottom line is no amount of talk therapy can help. The fact that you're working, 16-hour days, you don't have a day off, and it's just nonstop. And there's a threat of getting worse because of this Delta variant. Mm-hmm. And when you have, 40% more of the country completely unvaccinated, the potential for localized surges is there, for months to come. And I think they're just not looking forward to this. And they feel helpless, that, they've been sort of lionized as, COVID warriors. And, like you said, people bang pots and pans for them. But at the end of the day, if people don't get vaccinated, they are left to deal with the aftermath. They just are at their wits' end and frustrated. There's been a spate of suicides. And keep in mind, at least 3,600 healthcare workers have died of COVID, and tens of thousands more got sick and are dealing with long haul symptoms. So it's something that it's really hard to address that without either dramatically staffing up hospitals, which is not going to happen because there's a shortage of skilled nurses and critical care doctors. But because vaccination rates are sort of stagnated, I think the feeling is this is going to go on for a long, long time.
And, the thing about this pandemic, and whether it comes to, pandemic restrictions, mask wearing, social distancing, getting yourself vaccinated, it's become quite politicized over the last year and a half. And so now these conversations take on a whole new meaning. I mean, you never know when you're talking to someone who just didn't get the vaccine because they didn't have access, they live in a rural area, or because they believe in some wacky conspiracy theory about it. How has vaccine hesitancy, so I'm not talking about people who didn't have access to the vaccine and so they weren't able to get it, but people who are deliberately avoiding the vaccine for any number of reasons, how has that complicated the relationship between patients and healthcare workers and the way they feel about the job that they're doing?
Well, it's a huge factor. I would say most of the people who I spoke to nearly 24 doctors and nurses, and they all cited examples of patients who came in gasping for air. They ask, have you been vaccinated? And the patient will defiantly say, no, I don't, it's a hoax, or I think the vaccine's worse. I talked to a doctor in Detroit who recalls a 40-year-old woman couldn't breathe, shook her head defiantly when asked about the vaccine, and she later died. So, this is sort of traumatizing for a lot of doctors because it's entirely preventable. And because of sort of these conspiracy theories, the right-wing media has sort of inflamed these attitudes and theories about the virus. They are, at the receiving end of a lot of hostility. There's many reports of violence in emergency rooms, of doctors verbally and nurses verbally harassed by patients, and it's really set up a very toxic environment. And people I've spoken to said they've never seen it this bad, and there's a feeling of hopelessness.
Now, Andrew, I don't know if you discussed this or not with any of the people that you spoke to, but I was wondering about, what is the feeling about the future of healthcare staffing? We know we're dealing with shortages now, doctors, nurses, but is there a concern that people will not be attracted to the field, or at least with people leaving the field now amid the pressures of working through this particular period in time, that it's going to be a while before we can sort of ramp up and get the staffing that we need in our hospitals?
Well, exactly. I mean, there has been an uptick in medical school and nursing school applications over the last year. Not dramatically, but there has been an increase. But, that's a pipeline that takes years. Obviously, for doctors, it can take up to a dozen years before you're a full-fledged doctor. Nurses takes a few years. So, yeah, this is not something that can be solved at the snap of a finger. So there is this feeling of endless sort of toiling in the trenches, not just COVID, of course, but, just the entire gamut of dealing with emergency medicine. But I do think that the only, sort of short-term solution is more vaccinations. When you have 17,000 people in the hospital, like there are today, people with COVID, that's a lot of people that need to be treated. So if you remove those people from the hospital, certainly it'll make the burden a little bit easier for healthcare providers.
Andrew, really quickly, because we're kind of running out of time, but I want to ask you this. We've been doing stories on healthcare providers who do not want to get vaccinated. That has to complicate things as well in the workplace.
It does, but I spoke to many people who said it was really a minor issue. Obviously, the bigger the hospital chain, the greater the numbers of people unvaccinated. But for most people, most hospitals don't have a huge problem with that, I have to say.
All right, good. Andrew Jacobs, thank you so much.
Thanks for having me.